There's a lot of, black people who work in healthcare. And unfortunately, in healthcare, they are dealing with racism. Sometimes racism from the job itself, with the doctors, nurses, and hospital higher ups. And a lot of times with the patients. We have covered stories over the years where they have said they didn't want a black doctor. Not because the doctor was not, qualified or anything like that. No, just because he was black, or just because she was black, or they didn't want a black nurse, or whatever, right? So these people coming to the hospital supposed to be sick. If I'm sick at the moment, the last thing I'm worried about is things like that. Now, I understand the history of us in America and why we got to be careful, but they ain't got to be careful with anything. But I want you to hear this sister's experience dealing with, a lot of them who are anti-black racists.
So I've worked in hospitals for more than a few years, and I can admit the hardest thing about being a black woman working in a hospital is majority of your patients are going to be white. And depending on what region you're working in, like I've worked in Georgia, I've worked in Pennsylvania, Texas, most of my patients were racist white people. And when you go into that hospital, you leave all your prejudices outside. If you're an employee, you do not carry that in there whatsoever. But it does kind of like affect you, like you take some home, because once you sit back and you think about the people that you are helping and how they feel about you and your people, it's like it chips away at you. And you can't say much about it. You can't do about it. If you talk about it, you're considered racist or you're bad at your job. But in reality, it truly is one hell of a dilemma. Like, how many patients I've had speaking to me as if I was their servant, who's called me their servant. You know how many times I've been called a servant? The amount of racism that's in older white people right now, and that's majority of the hospital population right now because they're old, they need help. That's going to be, and not to mention black people don't go to the hospital nearly as much because first of all, we don't have health insurance or we simply can't afford it. So majority of your patients are going to be white. And to take care of a racist white person is one of the worst things I've ever had to do. And you know what the worst part is? It's the fact that they know that you know, but they also know that you can't do about it. It's not because, it's my job and I need this job for money. It's because it's my job and I genuinely don't have it in me to get rid of the compassion that I have for you as a sick person, to see you as a sick racist. The compassion that I have for you as a human being trumps all the feelings that I have about you being racist. But that racist person don't see you as a helper. They don't see you as a human. They don't see you as one human helping another human because this human needs help. They look at it as, you better. Yeah, you better and hurry up and do that. Now, I never let a patient talk to me crazy. That's probably why I had so many problems that I had. But the dilemma of taking care of a racist white person as a black woman is one that ain't talked about enough. And it's one of the worst things ever. If you know that your grandparents is racist and they're in a hospital, you need to stay with them. Or you need to encourage, something has to change. Because the kids, these white kids with these racist grandparents and parents, they're dropping them off in these hospitals and they doing whatever they want in these hospitals. Whatever they want. And the kids don't give a because they're under our care. It's one hell of a dilemma. It's insane.
Healthcare workers out there, I know, trust me, I've seen the story. I remember one video I covered maybe a week or so ago on Emancipation Media channel. And this one young sister, she was young, looked like she was about 23, 24. And she was a CNA. And this elderly white woman was talking to her the most nasty ways possible. I'm like, and she just sitting up there putting up with it. I'm like, I don't see how y'all do it. I cannot deal with racists. I don't care if they're sick. I can't, you're not going to talk to me like that. I'm not going to put no hands on you, but I'm just going to walk off because you're going to sit up here and say a bunch of evil and vile things to me or talk to me like you say, a servant. Man, that ancestral rage of clicking me to my servant, like, nah, I'm good. Let me leave because I'm going to hurt your feelings and I'm definitely not going to help you do anything. And I don't want to lose my job or definitely get in trouble. So let me go on and leave out of here. Ain't no way you're going to be telling me I'm your servant. Like, please. This a hospital. This is not the spa. You know what I'm saying? But this with that culture, all this stuff is within that particular culture. And that you can talk to black people any kind of way because you don't have to respect them. We're superior. even if we destitute, if we're poor, if we're sick, we're still superior to you as a black person. So I don't have to respect you. I don't have to talk to you right. I don't have to do anything whatsoever with you. I don't, because I am superior to you, and that is cultural. And I understand, with your healthcare worker jobs, you got to deal with the public, and I understand the public is something else. Oh, don't understand. But she talked about how a lot of us don't go to the hospital. Well, yeah, a lot of us don't go because of insurance. Some of us don't go because fear the way you're going to be treated in that hospital. That's another issue too. In a perfect world, that's why, we need to focus on building institutions. Institutions like a hospital. That's considered institutions that is needed. An institution like a health clinic. Dentist offices. We need to build all kind of health institutions, mental health centers, where people get, mental health treatment, counseling. Those are institutions that we need. We need Black American centered institutions. If you look at all the money, a lot of times that we waste on brands, waste on drinks, $15 to $18 on drinks, we could have had hospitals and clinics and daycares and retirement centers for our elderly. And that we can hire our people in the community, our healthcare workers, into our hospitals, and that we don't have to deal with all that mess that go along with working in their stuff. Because good and well with a black patient, you're not going to deal with none of that racism. Now, I'm not saying you won't have a black patient be rude. I'm not saying that. But what I'm saying is at least you're not going to deal with no racism. We got to focus on building institutions. We need those brothers and sisters to build it, because we have people in our community who who worked in these systems, know exactly how to get it done, and we have to do it. Everything can start small. The Bible even teaches don't despise small beginnings. Don't do that. Walmart, big as it is, started off small. Apple started off small. Amazon started off small. No matter what corporation you would think of that's big today, all had a small beginning. Because nobody's corporation become that overnight. It takes time, years, and dedication. So what I'm saying is let's get into build. We go into 2026. It's one thing we could talk about issues like this, and we should. But it's another to hear this and say, let's act and let's build our own institutions like hospitals, clinics, like I said, all of that. Let's build our own institutions that take care of our community. Listen, in a perfect world, the black community shouldn't leave the community for nothing in a perfect world. You should go to the grocery store in your black community. You should go to the doctor in your black community, the dentist in your black community. Anything you could think of, you don't have to leave. You can just go down the street and it's in our neighborhoods. That's how it should be. And the gas station is your community. Everything is ran by black Americans. But we got to focus on institutional building. That's what we got to focus on, period. If you don't focus on institutional building, we're going to keep dealing with these problems. It's just that simple. Okay, now we delineated. Beautiful. Now let's build institutions now that we got our focus on the right thing. We got to have more and more institutions. Like we got to have schools. We got to have that. That's an institution. Grocery stores, feeding ourselves, farms. That's another institution that we got to have. And we don't need to ask for permission from them folks to do any of it. Just like you didn't ask them folks to delineate, it's the same thing with building institutions. You ain't got to ask them anything. We just get it done. We build. But no black person should be subjected to that kind of treatment. And you got to still have a heart and compassion with someone treating you in that manner. Because not everybody don't have that kind of heart. I'm sorry, you ain't gonna sit up here and just talk to me crazy and abuse me and think you gonna get the goodness from me. No, that's why I was like, let me leave here because you're not gonna talk to me like that and expect me to help you. No. But I hope she get a better situation. I really do. Because working with them kind of people, yeah, I couldn't do it.